Hello everyone, my name is Dr. Harry Kunelis and I'm a neuromuscular dentist with a specific focus in TMD and chronic pain related problems, specifically of the head, the neck, and the lower jaw. I got started in this field because of a 17-year-old patient who was in a car accident and came to us for treatment. He had suffered needlessly for 2 years, seeing various specialists in the field, seeing radiologists for MRIs. Ultimately, over a 2-year period, the only thing that had worked for this young man were 21 Botox injections in his face. The reason we were able to alleviate and completely eliminate this young man's problems was because of factors that differentiate myself from other neuromuscular dentists in the field. And those factors, realistically, are the ability to take various techniques and various schools of thought in our field and applying them on a case-by-case basis to each particular client or each particular patient. In other words, currently in medicine, there is not a standardized process on how to treat head, neck, and jaw problems from a dental component or from a dental standpoint, let alone from the whole body. So where my approach differentiates myself from other neuromuscular clinicians is the ability to take not only a neuromuscular dental approach in treating these cases, but also other approaches within our field that have shown results and put them all together and apply them in a way that's consistent for each individual patient and each individual case. The tipping point to differentiation, of course, is putting the whole body together in what we call this chirodental team approach. And the team approach, alongside with utilizing various behavior and various techniques in dentistry, is the real reason and the real secret on what differentiates myself from other neuromuscular dentists and other clinicians in the field. We'll give you a brief second here to introduce a good friend and colleague of mine, Dr. John Heyer, who's a chiropractor. And Dr. Heyer, how are you doing?
Good to see you. Hi, everybody.
Dr. Heyer has worked with me for the last 5 years here in Frankfort, Illinois on some very complex cases. And in fact, he was the treating chiropractor on this particular story of a 17-year-old young man that I just alluded to. And maybe Dr. Heyer can give us an indication of how his approach in chiropractic dovetails into our approach in neuromuscular dentistry to get the results that we get. Dr. Heyer?
Thanks, Doc. Yeah, the case that we're talking about was really, really challenging, and I'm glad that we could help the young man out. Real quick, the best way to show this is through pictures. Let's use this analogy here of the spine. And you see 3 upside-down triangles. This lower triangle represents the pelvis and the legs beneath. This middle triangle represents the torso and the thoracic spine. And this top triangle represents the head, the neck, and you can see the jaw right here. When everything is balanced, everything is lined up. The feet are even, the spine is even. But here's the problem. Sometimes with an injury, like a car accident in this case, or bad posture or other issues can cause the triangles to become out of balance. You'll see here that the legs are not even. The pelvis has tilted left, the torso has tilted right, and the head and the neck have compensated as well. But you'll notice something interesting, the jaw itself still hangs because it's like a pendulum. It hangs freely, but what you can't see according to this picture is all the stress and all the tension accumulating in the jaw, in the head, in the neck, and throughout the body.
So what you're saying, Dr. Heyer, if I'm reading this symbol properly, is that the problem can originate in the jaw, the problem can originate in the lower half of the body, or a combination of the above, or any of the above.
Correct. What we call them ascending or descending. Is this person having a problem because it's ascending from the bottom up? Is it a foot, pelvis, spine issue? Or is it a descending problem originating here in the head, and neck, and the jaw and affecting the rest of the body?
So as we can see, with this explanation that Dr. Heyer presented to us, that the problems may arise from the jaw, the problems may arise from the lower half of the body, and whether or not they're an ascending or a descending issue, is what we call them, is going to determine how we're going to approach this case. So I'd like to thank Dr. Heyer for coming out and sharing that with us, Doc. Thank you very much.
Thanks, Doc. Bye, everybody.
To wrap things up, this is a good indication of why the team approach, a chirodental approach, is almost absolutely necessary to treat these chronic pain-related issues where somebody has ringing in the ear, they have chronic head pain, they have chronic head and neck, shoulder stiffness. All these problems of the head, the neck, and the lower jaw are not always necessarily related to what's happening up here. They are sometimes related to things that are happening in the lower half of the body. So the team approach, the chirodental approach, is an approach that allows us to get consistent results in an efficient manner. And if you'd like to know more information on any of this chirodental approach, click to the right of your screen and we'd be happy to see you on the flip side. Bye for now.